All right, welcome back to the podcast. Had a week off. Kate and I were in Puerto Rico for Thanksgiving.
Did you almost forget where we were?
No way.
That means you were really relaxed.
It was like a dream. It was in the way that it almost seems, because it's like it's such a different season. Like the kids were confused that they were coming back to winter. They were like, "Oh, it's going to be summer," because really we'd only had a week where it was kind of cold when we left. It had been such a warm fall when we got back, and it's like we just got kicked in the
blast to the face with the
20-degree weather.
I was here; it was awful.
Yeah, so it's not a bad way to spend it. I've never done a warm holiday before, so
that's great.
It was a good way to spend it. So today we are here with Dr. Mandi, so our resident physical therapy partner here with Affiliate. She's going to talk to us today about dry needling. We've talked a little bit about it before, but they're coming hot off the heels of they just hosted a big seminar clinic here, and they all learned a bunch of cool stuff, and they're going to share it with us. And I'm excited to hear about it because I get needled all the time, and it's what's kind of kept me in the game the last 10 years. So turn it over to Mandi, and we'll have plenty of questions for you. So
So I kind of wanted to start by, I guess, thanking Dry Needling and you guys, because that's kind of how I ended up here in the first place. So I got certified originally in 2014, so like 10 years ago. And then maybe like a year after that, I talked to my friend Greg, and he's like, "Hey, I think the guys at CrossFit Grandview would really benefit from this." So started working with the coaches, and then started working with you. And back then, when we learned dry needling, it was a very different technique than it is now. In that the focus of it, I think, was more like, hey, if you have an acute injury, or maybe even something chronic, but some very targeted thing that we're going to go after. In particular, I'm sure you remember like some of the early days of needling were like, oh, there's a trigger point right there. Yeah. I'm going to shove the needle in that and get that sucker to twitch so that it relaxes. Yep. And we still do some of that, but I think over the last 10 years, our practice has evolved to where now we'll hook it up with electrical stimulation to get that muscle pump and get that muscle to relax. And now the focus of our course that we just took last weekend was kind of relearning some techniques, rehashing some things, but there's a ton of evidence now that dry needling is really, really beneficial for a recovery piece in our training. So, and not just thinking about like a muscle pump, similar to if you were to wear like compression boots or go do cryotherapy, like we can get that nice muscle pump from the dry needling with the electrical stimulation in particular. But I think the biggest thing that's come out in the research since we started doing this 10 years ago is it can really be this like nervous system reset. And I think like everyone in the room here and a lot of people at the gym are all into biohacking and anything we can do to recover faster, perform better. And what we found in the research is that dry needling of a different stimulus, of a different setting on the electrical stimulation applied a little bit differently than we had done in the past can really be this neurological system maintenance. And what I mean by that is like, we know needling is the most precise thing we have for getting to a specific muscle. Like it's even more specific than a joint manipulation. Like joint manipulation works really well for decreasing pain, increasing your fluid flow, making you feel better. But what they've shown in the research is it's not super accurate at getting to like a specific joint level. And that's okay. People feel better from it. You move a little better. But it can't target a specific muscle or a specific joint. With needling, we can really target that. So we know that muscle feels better, but what we also know now is that that signal that comes from the prick of the needle in the muscle not only sends the signal like to your brain that says, hey, relax that muscle, calm it down, trigger that inflammatory response to bring fresh blood flow to the area, stimulate that healing process. What it's also doing is like sending a signal back from your brain, so through the spinal cord up to your brain, back from your brain to that muscle that says, hey, you can fire a little better now. You can feel a little more coordinated. And some of the things that happen with an injury, like, very acutely, you'll feel like that muscle kind of shuts down for you. The dry needling can help with reactivating that muscle. And you'll feel that in your workouts, but there's a ton of evidence now that shows not only does it help you turn on that muscle, but it actually helps with hypertrophy of that muscle. It helps with, preventing re-injury of that tissue as well. So biggest indicator of pain and injury is having a previous injury. And we can combat that with some obviously rehab after, and then continuing some prehab things preventatively to say okay, I'm going to keep an eye on this. But we all know once something starts feeling better, we kind of let those things go because it feels better. Why would I do that? But there's always something still on our brain that says hey, that ankle that you rolled 6 months ago, I still kind of feel it, that it's not up to 100% the other side. And there's research on that, right? That anytime we have an injury, we get this, what's called cortical smudging on our brain. So you literally lose the capacity to process sensation there and motor firing in that area. And what we get from dry needling to that specific area is a better firing of that muscle, a better pattern of movement. From dry needling there. And then the other piece of that is that we also get this huge flush of fresh blood to the area, good feel-good chemicals to help with that recovery piece. And then the other aspect of that is that if we're not even injured, say we want to get a nice flush of fluid similar to compression boost or something like that, we can put a needle in some of these bigger muscle groups. So think quads, hamstrings, glutes, lats, turn up the stimulation to a certain point to get that muscle to contract and get this huge pump of fluid to that area. So neurological changes, not just in
probably
your
helps
muscle.
with the lymph then as well.
Absolutely.
As we're moving into the flu season and just flushing and
Absolutely. Yeah. So your biggest piece that you need to recover from a workout or an injury is that venous return. And the best way you can get that is with a needle in a muscle, electrical stimulation, pumping that through.
Yeah. So I have a question. So you were talking about the neurological benefits, and it makes sense, the neural pathway to an injured area. But let's look at this a maintenance phase where you're just working on larger muscle groups. Would it have some sort of effect neurologically too? And I'm just kind of making a stab here, when you do a cold plunge and you're oh, I'm so cold, but it's almost little injuries, and then training your body to kind of work through that in a way okay, we feel that little sting here, that little sting there, we're going to flush it and you're okay. You're okay. So it's almost kind of with, we're big on meditation, in everything proactive.
Yes.
If you guys have listened to this podcast, so this can be, I think, just a way to view this. And that's how I use dry needling. I'm on the schedule every month and I don't have reoccurring injuries, but there's always something I can focus on. But right. I really do feel there's some benefit that keeps me healthy overall.
For sure.
That it can just kind of turn on your parasympathetic system, your vagal nerve.
So think of, everything we do in here is sympathetic stimulation. When we try to do things like deep breathing and cold plunge, that's all that parasympathetic stimulation. That's exactly what dry needling does. And it is the most targeted way to treat, if something is going on, hitting that area specifically, but we can even hit adjacent areas or further away and still have that gross effect.
Yeah, because I think everyone understands, hey, this is an injury. They understand getting the blood flow there and to treat that. But to really kind of conceptualize, and I think that's what That's what I'm really trying to teach people with my clients. Like, let's not wait until you're in a shitty situation.
Yes.
And I try to live my life that way. Like, if I do a load of laundry a day, I don't have a shit ton of laundry. I mean, we started on Christmas presents last night, and Brandon's like, what do we do? I'm like, I don't want to have a horrible day.
You got to get ahead of it.
If we each do 2 presents every night, we're not going to have this horrible day.
Yes.
So to kind of wrap their mind around this dry needling as another therapy, like the sauna, like breath work, but it's kind of active therapy that you're doing, not so much passive, because you're teaching your body to calm down, like the breath work. So this is all to incite a little bit of like anxiety and then teach your body to calm down, which sounds uncomfortable and why people don't like it.
Yeah,
And,
I mean, it still is a needle, but they are, if you've never had it before, it's like a pine needle. Like when you get an injection or even a flu shot, the width or the thickness of that needle is like 2.0 gauge. These are 0.02. So they're super small needles.
Yeah.
It's not bad.
The prick of the needle is not what's uncomfortable. And I think, like I said, the previous way we used to needle was like, hey, you have an injury, we're going to target it, and we are going to piston that needle till that muscle relaxes. That is uncomfortable. You get a great result from that. That style of needling is uncomfortable. Now we're saying, hey, we can just go like, and that was the biggest thing I got out of this course is like, you don't have to go super deep into
Minimal
that muscle.
impact.
If I'm just in a motor unit of a muscle, even pretty superficially, and turn on the stim, I can get it to contract and get that effect without it being very uncomfortable.
Yeah.
But
I was just going to say, I'm a good person to speak on this because you were the first one that treated me, and literally for like 6 months, I was such a pussy. I'd be like, okay, I just don't want needles.
I wasn't going to say
please, like soft tissue. And you were so nice. You were really patient. And then I was like, all right, Kate, come on, like get over it. And it really is like a mental thing because I love massages. I love body work. And you guys offer massages as well. But this is this is going to be a little bit more effective when you're dealing with kind of like a reoccurring or just really in general. I mean, I love massage, but the more passive it is, you're probably not getting as much out of it.
Yeah, so I mean, we can put recovery things into like 3 different buckets. There's like active recovery, so you can come in here and like ride the bike, do something really light. Passive being like massage, but then there's like facilitated, and that's what this electrical stimulation with the needling gives us. That really great venous return, muscle pump, recovery piece that you can just lay on the table and do it. Now we're always going to give you some recovery exercises or something after it, as you guys know, but that facilitated assisted recovery is kind of like that sweet spot for getting some real benefit out of it.
Yeah.
I've really noticed, even like recently. So if I have particularly like a re-injury of maybe something that can be somewhat chronic, my nervous system will really ramp up. And that's almost the worst part of it. It's not that it's like, if this was just an acute injury, I would be freaking out as much as like, man, this has happened 6 times.
Sure.
Re-injured it, and then my nervous system, because it's anticipating months of pain. And then,
missing workouts.
Yeah. And then, but when I'll get the needles in it, it helps calm that whole nervous system down. Yeah. I really noticed that when I tweaked my shoulder.
Well, and I guess that's kind of why I wanted to come on here and do this like refresh of it, because I've been needling you since 2016 now, and we know it has benefit, but I think understanding why it is so beneficial, and it's because it impacts your nervous system.
Yeah.
So it's like hitting Control-Alt-Delete on your nervous system to say like, hey, yes, you had this shoulder injury, it hurts, but we don't need to have this giant fire alarm going off that it's in pain. It'll be okay. We're going to calm it down, get some fresh blood flow in there. And again, what it really does is it sends it through your spinal cord to your brain and then back to that injury to say like, hey, you don't need to send off the fire alarm. Yeah. Like, this is just a little tendonitis thing that will go away quickly in a few weeks.
Yeah, I haven't even had to miss workouts really. It's just like kind of work around stuff a little bit, but at first I'm like, oh man, I'm going to have to not use my arm for a month, and I haven't even missed a workout. So It really, it helped like tremendously. And it had been a little while since I had done it. And now I'm like, ooh, I need to get back on that. I was really like, that really is so helpful. So
I think what's interesting is like when we started doing needling, we're like, God, this stuff works so well. And I still see this with some patients. It almost works too well, right? Like you feel so,
keep beating up your body.
feel so good from it that then you're like, well, I don't need to do those couple exercises she gave me because it's feeling better. It feels great now, and I'm going to pop back in my workout. And then sometimes people come back in like a week or two later, and they're like, oh, it's kind of sore again. I'm like, well, did you do your exercises? Did you modify what we talked about because of this injury? Well, no, it was feeling really good. And that's where a needling can be like so sneaky good is you'll just think you're invincible
It's turning pain off to where like, that some of the other surrounding structures might not be stable and things like that.
Yeah, you've got to fix, what needling doesn't do is fix the reason something got injured, right? So it'll manipulate the pain signals. It will manipulate some of the tightness and lack of mobility that you have there. But we always want to get to the bottom of like, why did this happen in the first place? And that comes from our assessment and other tests and then some exercises after.
When I think a good like parlay, because I was going to kind of mention that too, is all the stuff you don't want to do is why this really works. It's all the exercises that you're giving at the end. It's the stretches, your physical therapy. But then, what we're really seeing, and it's been such a theme on our podcast, is this neurological kind of almost dysfunction that a lot of us are in, whether it's our nervous system, like, and that's something even with your shoulder injury, that needling really worked, but then it came back and it was more of a neurological injury. And Brandon worked with a coach that we both work with. And she was like, I think this is a lot of kind of emotional stuff here, stuck grief. You've got to work through this emotional component. So there's always underlying. We had Gretchen on here where she was talking about her injury. And then, it wasn't just the needling. It was like calming her whole nervous system down.
And she's doing like belly breathing and meditation.
Yeah, yoga. So it's beyond what any one person can do for you. And I think that's what no one likes to hear. They want to go to a healer that fixes them. But the healer really is telling you, this is the problem. Now you have
to fix it.
This. And then that's where we should be proud of ourselves if we feel good and if we work through this, because this work is hard. It's not just external work. Yeah. It's internal work. And I think that's what makes me excited about like the health industry almost all over again, because it's like each person is a puzzle. And we're all so different. You can't just say, oh, she grew up here with, this sort of lifestyle. It's a family dynamic. It's your whole life that plays into how you feel and what you need to do to kind of correct from where you're at. And half of the population needs to be amped up a little. Like you need to work a little harder. Like get off your ass, go for a walk. And then you've got, the people like the three of us, we just need to like calm down. Calm down. And we all probably need to calm down, but in a different way, right? Like, you and I probably need to move less and calm down. And Brandon needs to get up and walk outside when it's 30 degrees. But it's really interesting how each person is a story and it's so specific. And you guys, I mean, I can attest to that. You guys really will coach to that too. And it's not just the injury and these physical therapy exercises. Yeah. What's neat is you have relationships that last for years. And you're like, okay, Kate, I know what you're saying to me, but I also work out with you. And what you're saying is not really true. Like
I've seen you do that move. It doesn't look like that.
Right. Yeah. Or you think you're taking it easy, but I've watched you. You're not, and it's your perception of what you're doing. It's your perception, and it's easier kind of for someone outside.
That is so helpful with you guys in the gym where you're living the workouts and a lot of the training, and maybe you're doing power hour or CrossFit or one or the other, but you're seeing most of what's going on, and so you can wrap your head around it.
Suffering right along with you.
Yeah, and you're seeing people moving too, where it's not I haven't seen you in 4 or 5 months. You just walk in, and then it's like, you know, you're going to treat people and run through your thing. And that's how it works with a lot of clients. But a lot of the clients you have, you know, on a level that is like, it's different. And it's like, you're almost like a trainer or coach too, you know, because you really know.
Yeah, I know exactly how people move. And I can't help but watch when I'm working out. Like I am always watching everyone move.
Yeah.
Well,
I can't help it.
It's cool when you give me exercises and things. And I mean, I have them stored in my computer, like all these things. They become my warm-ups in class all the time. It's hilarious because my class is always like going through like banded hip things.
And they're probably
stuff
like,
that
where
learned.
the heck did he come up with this?
But it's always before we're going to do like a squat or something.
Yeah.
And I'm like, guys, I hurt my hip like 3 years ago on a clean. I'm like, we are going to really get these hips and your glutes all like firing the right way before we hit the clean. And we're going to make sure our legs don't go out too wide because my injury is becoming like your injury prevention before it happens. But it's a lot of the stuff that I've learned from you guys where that's how we prep everyone, and it keeps my classes way healthier. I always say, like, it sucks because I've gone through – I've tweaked, you know, pretty much every joint, like wrists, knees, ankles, and shoulder, like every single one of them. But it's helped me become a much better trainer and coach through doing that, because when I know we're going to really hammer one of those like movements, I'm like, we're going to really make sure.
Or when your clients are feeling an ache or pain here or there, you understand it more.
Yeah.
And what's interesting is how you can watch someone, I was just thinking about this, move with like, I'd probably be more one of those people. I when things get heavy, anywhere close to my max, I start to just look like shit. I'm like the person.
Everyone. Yeah.
I don't know. You don't want on video. Like, if I've got something light, but if I'm going hard, you don't want me on video. But I tend to not get like really banged up and injured. So I just kind of was having this thought, like, for a long period of time. And I think because I've implemented so much of this, like meditation, this calming, reduce my work hours, like really I'm always kind of playing with my balance. It's helped me kind of like work through some of that where I always need to work on my movement patterns. But Brandon moves really, really well. You move really, really well. And it was just making me think of this because we were talking about the cleans. We did cleans on Monday, and he's like asking me what I did. And I was like, 135, but it looked real bad. And I only know it because of Jack's face, and I felt it. But he's like, oh, like, please don't do that again. And, you know, Brayden was like, well, I had to stop myself. And I'm thinking, man, I never have to stop myself. Now, there's a strength issue there, but then also I do think there's a neurological issue there, where if you, like, really attack this instead of from, like, the injury standpoint, but the neurological standpoint, like, of just always calming down your nervous system, that's the best place to focus because your movement patterns are so good. You don't want to have to be perfect or you're screwed, where like someone like me needs to always work on like those movement patterns. And it's just so interesting, like each person, and you move completely different after you've done Power Hour for what? Almost 2 years
Power
now.
has like changed my workouts totally.
It's so cool to watch you work out. I only just had to badger you for like 6 months.
I know. No, it's like years, I think.
Yeah. I was like, quit doing Rev.
Yeah.
Quit doing Rev.
Finally caved.
And then Rev's great, but you needed Power Hour. Yeah. Everyone has their medicine, right?
Yes. Well, everyone always wants to do what they're good at.
Right. Right. Yeah.
It's the things we suck at we don't want to do.
Yeah. So. But it is fun watching you now. But I think it's just very interesting how each person can benefit from a service in so many different ways, whether it's in here at the gym. Hey, right now you need the Power Hours to gain strength, or we need to head over to the Revs because you've been doing Power Hour forever, or CrossFit or whatever. And the same thing with the needling, how it can be very dynamic, where you have someone that's constantly like buzzing up here that needs to calm down. Yes. And a lot of it is your stress load, how much you're carrying on your shoulders outside of the gym.
Well, and I think Pat does a really good, Dr. Pat, who actually teaches the needling courses. So he should be the one on here explaining all this, but he does such a good job explaining like what can happen after we needle. And it's that we get just this beautiful window of time where our nervous system is reset. We get a chance. It's almost like a clean slate to look at, like, okay, we were moving this way before, maybe because of pain. Can we clean up that movement because now maybe you feel a little better, and change things up. So it's this nice, just like window of opportunity to move a little better, feel a little better, and actually fix why this happened.
Yeah. That is that window where it's like, okay, now I have this, I can get into all these exercises and movements that are low risk and things that you can get into without being nervous. Because when it is all inhibited, it's hard to, you're scared of even doing those.
Right.
Yeah. You know? Right. It does open that window up, and that's where it's been really helpful for me.
And sometimes I think movement patterns can just be very poor because you're generally exhausted.
Oh, yeah.
You're just generally tired and don't have the energy to put into it. That's where I feel like I fall. I've always over-exercised, overdone everything, and then... No. Well, we had this healer on. I don't know if you watch that podcast, but I just saw her yesterday. She's my intuitive healer, and she works with fascia, and she just went to a fascia course and dealing with addiction. And this guy's theory is everyone's addicted to something. And I'm like, okay, go ahead and do the test on me. What am I addicted to? And she's like, overdoing it. Everything. And I'm like, okay, it sounds about right. But yeah, it's an interesting sort of concept to think about in like the story behind each person's body.
Yeah, for sure. So yeah, I think like to sum that up from like a gross level, like we can use the needling to increase the stimulation or increase the firing of a muscle, and it's nice for that, but we can also use it to downregulate things. So
which everyone
someone who
can
is
use.
Riding high up here, we can level that off a little bit, get everyone back to baseline.
And just to throw in our promo, we are offering a kind of a promo here for the beginning of the year with Affiliate PT and also the Body Biz. If you want to be more proactive in your recovery with dry needling and massage, and then also be a little more proactive with your nutrition and workouts.
Yes, you'll get one 60-minute PT session, one 60-minute massage session, and then all this stuff from the Body Biz as well for one flat rate for a month.
Yeah. So we will be throwing out a post about that, but have a good day.
See you guys.